sending you an email, but now I will not. Okay.
Thank you.
See, done. Business.
I was wearing a hat.
Always better in person.
I can't.
Disheveled.
I can't go out in public after wearing a hat. It would just be not that good. That's right. That's right. I have to choose one or the other. I can't be like halfway through the day wearing a hat and not. Because it will look like I've been wearing a hat.
Well, you could wear it on the second half of the day.
Yeah, so that is the only option.
Well,
that
see,
was
that's what
Started out
Randy was
without it.
talking about was
It's gonna jump right back up tomorrow. It'll be like 70 degrees and sunny tomorrow.
Or-
Mark's on the phone.
Within
And
6
that's
days,
what
it'll be like in
I'm
the
just
high
not that
80s,
brave, you know.
according to my
That's
app.
gonna come off.
Going back. I think Brenda has these.
I will.
She likes it all.
You better
She likes
enjoy
it
this
this
cold
way.
weather while you can, because I think this
Low
is it.
pine top.
Yeah,
Well, I
it's
get
gonna
special
start.
Yeah,
treatment.
it's gonna start heating up after.
She's not really
This is
fussy
why
about my
I
hair.
just like bundled up. I got my cold weather stuff.
She is
on.
like
Yeah,
the
I
inner
have
you.
a coat in my car.
That's right.
She
It's
likes
like
it
an
for
LL
There you
Bean
go.
catalog.
he's kind enough.
Mark
I'll
and,
go home and
Enough for her.
snap my cold coffee.
what's
I'll
her
go home
name,
and
Faye,
make a cold
are on
hot
the
coffee.
phone supposedly. I'm not sure about Angelica.
You drink so much coffee lately.
ADNA.
You're just used to it. My dad used to do it. He called it coffee cocktail hour.
Yeah, swap it.
I assume that's downstairs, Jill. The proclamation is what we're waiting for.
Yeah,
She went to get it.
she went to get
Oh,
it.
okay. Interesting.
Hey, can you guys hear me?
Yeah,
Is that Angelica
Yeah, I
Okay.
did my one
or Faye?
love story.
sounds like Angelica.
I told you I wrote
Hi, everyone.
Okay,
It's me, it's
There
Faye.
she is.
it's Faye. All right.
I
Thank you,
love that
ma'am.
book.
There we go.
There we go. Got you, Mark. Councilman Rodriguez. Also, we call to order our special meeting for today's city council. We have a roll call, Ms. Adams.
Mayor Clea McCaw.
Present.
Vice Mayor Carolyn Flowers. Councilmember Faye Jackson.
Present.
Councilmember Ken Kilmurray.
Present.
Councilmember Angelica Landry. Councilmember Brian Myers.
Present.
Councilmember Mark Rodriguez.
Present.
Mr. Mayor, you have a quorum.
Thank you, ma'am. Item number 1, Vice Mayor Flowers.
Oh, is that no?
Yes, ma'am.
It's all out of order now. Sorry. Thank you, Mr. Mayor. I move that the agenda for the special city council meeting on March 10th, 2026 be approved as written.
Second.
Been properly moved in second. Are there any discussion items? I'll call for the vote. All those in favor?
Aye.
Faye?
Yes, sir. I can hear you.
Oh, we called for the vote. Is it an aye or nay for item
Aye.
number 1? Thank you. All, all is opposed? It's passed. On this afternoon, we have one proclamation for the My Kids. I think we have representatives. Yes. You can stand with me. Oh, good to see you. Proclamation from the City of Sierra Vista. Whereas mental ill kids in distress, My Kid, is an Arizona-based 501c3 nonprofit organization dedicated to improving the mental and behavioral health of children and youth through a family-oriented approach, promoting mental and behavioral health awareness and supporting families. Whereas My Kid provides education, counseling, resources, respite care, and support to families of children and youth experiencing challenges such as depression, anxiety, ADHD, autism, and other behavioral health needs. And whereas My Kid offers a peer support, training, education, support groups, transitional age young youth programs, health promotion, and community-based living skills programs designed to help children and youth develop coping skills, resilience, and the ability to manage their own physical and mental health. And whereas on March 11th, 2026, My Kid celebrates its 39th anniversary of service to thousands of children, youth, and families throughout Arizona, including Sierra Vista residents, contributing to the stronger families, and more supportive, inclusive communities. Now, therefore, be it resolved that I, Cleo McCaw II, the mayor of Sierra Vista, Arizona, do hereby proclaim March the 11th, 2026, My Kid Day. In and for the city of Sierra Vista, in witness whereof, I have hereto set my hand and caused the great seal of the city of Sierra Vista to be affixed this 10th day of March in the year of our Lord 2026 in the independence of the United States of America 249. Cleo McCaw, Mayor. Any words?
We're very excited to be in Sierra Vista and offer the services for this community as it is not readily available. So we are anxious to continue to grow and continue to support our families and be here making a difference for our community. Thank you very much.
Beautiful. 1, 2, 3. Thank you.
Thank you.
It's under one, right? I can.
In our new business, item number 2.
Want me to take it?
Yeah, go ahead, take it, sir.
Mr. Mayor, I move that Resolution 2026-012, entering into a cooperative agreement with Arizona Land and Water Trust, ALWT, for FY25 Readiness and Environmental Protection Integration, REPI, Challenge Program funding be approved.
Second.
Been properly moved and second. Staff report, Ms. Broussard. Good afternoon, ma'am.
Good afternoon. Mr. Mayor, members of council, in 2025, Cochise County, in partnership with the City of Sierra Vista and supported by Fort Huachuca, was awarded fiscal year 25 Readiness and Environmental Protection, or REPI, Challenge Program funding. The amount awarded was $1,807,185, and the purpose of the funding was to establish an endowment to support ongoing maintenance and monitoring needs for city and county water resources projects, which help to support Fort Huachuca and its missions, as well as protecting the area's natural resources. The intention would be to grow the endowment over time as additional funds become available to support these needs moving into the future. Fort Huachuca will be the direct recipient of the funds, and the most expeditious route to disperse the funds is through existing cooperative agreements. Arizona Land and Water Trust has an existing agreement with Fort Huachuca and has agreed to work with both the city and the fort to convey the fiscal year 25 REPI Challenge funds from the fort to the city. The city will then use the funds to establish the endowment as stated within the grant proposal. In accepting the funds, the city is acting as a designated fiscal agent of the Adaptive Management Committee, which is comprised of the signatories of the Bureau of Land Management Memorandum of Understanding. The $3.6 million in partner match funds referenced in the proposal have been provided by external agencies or were previously budgeted operations and maintenance costs, and no additional city match is required. I'd be happy to answer any questions.
Excellent. Any questions from, yes, sir?
Appreciate that you look straight over.
Oh, you're the only one over there.
Hey, Sharon, so is this the first time we've received funds on this? Is this the first time through this iteration?
For the REPI program in
REPI
general?
program.
No, we have, we received funds in 23 as well.
Okay, so what's our total endowment right now?
Sorry, specific to the endowment, this is the first funds we have received. I thought you were talking the REPI program in general.
And do we have an that was a lot of complicated reading.
Very much so. Thank you.
So is do we expect to receive subsequent funds for the endowment over the years, or is this a money-raising opportunity for people or organizations to donate to this fund over the years?
Mr. Mayor, Councilman Kilmurray, I would put it more in the latter category. Although we could certainly apply for additional REPI funds moving forward. I think the fact that 1.8 million has already been given to us would make it less favorable for us to receive REPI Challenge funding in the future. However, it does provide that seed funding for others who may be looking to contribute to the opportunity. This was a very important first step to get this into place.
And for the new council members, could you give them like a history of how we got here?
Oh, well, sure. Thank you, Mr. Mayor, members of the council. The AMC group that Sharon alluded to in her presentation, it's called the Adaptive Management Committee that I chair on your behalf, and Bureau of Land Management, Fort Huachuca, Cochise County, and the city are all part of that. So the city acts as the fiscal agent for this particular group. And there are a lot of, the funds are necessary to support our ongoing operations and maintenance costs for the various activities that we're engaged in. Those include things like groundwater modeling, monitoring of well levels, and then monitoring of the conditions on the river. So there's a lot of costs associated with operating this. And our plan is to try to grow the endowment, for which this is the seed money, to hopefully live off the interest in terms of our ongoing O&M needs. And actually, I'll be chairing a meeting tomorrow to discuss this. So this has been an ongoing effort.
Any other questions from the dais?
Yeah, I got a couple more.
Yeah, go ahead. Yes, sir.
So why is the city the lead instead of Fort Huachuca, since they're the beneficiary of the funds?
They're the beneficiary, but because the city and our procurement has the ability to work with all the various agencies, because there's different procurement rules with regards to how the Fort does things, even how BLM does things within the federal government, state and local. We have always served as the fiscal agent, is the term that we use for that, for all these things, and we have a lot of experience dealing with the various agencies. So it has always been the city that's kind of carried the ball with regards to both contracting and financial responsibilities.
So Sharon is listed in the paperwork as the point of contact, but you actually chair the board.
Yes, I do.
So there's costs administering this. So are we able to take the REPI funds and it reimburses the city for its costs?
Yeah,
Do you do it on
these particular funds, yes, we can, which will be part of our discussion tomorrow. We use consultants a lot to help do all the coordination. There's a lot of technical coordination as well as administrative coordination, grant writing, those kind of things. So Holly Richter, who has the company called Resilient River, has been long involved in these, and she's our primary consultant for the use of these funds. But then we also have to distribute funds to consultants that do modeling, USGS, who does the monitoring of the well levels and those kind of things. So the money gets dispersed to different groups from us, and that's all handled through the committee.
And so this actually isn't a budget line item in our budget, is it? It's just something that we administer on the side?
Yes.
For the community?
That's correct.
Okay. Okay, thanks.
Thank you. I'll call for the vote. All those in favor?
Aye.
Aye.
Thank you, Mark. Faye? Councilman Jackson?
I think I heard you say that.
I'm sorry, sir. Repeat that question again.
I'll call for the vote. All those in favor?
Oh, yes,
Thank you.
sorry.
Opposed? Hearing none, it is passed. And we will adjourn out of the special meeting.
Yes, sir.
All right, we adjourn out of the special meeting, and For our presentations today, we have staff presentation of the transit routing study. Ma'am.
Mr. Mayor, members of council, I'll introduce this and then I will call up our consultant from HDR to give you the presentation. But this has been a substantial effort. It started with a council strategic plan item to study the efficiency of transit operations and to focus service on those who truly needed it. At the same time, we had the challenge of going through COVID, which obviously had a significant impact on transit systems nationwide, not just in terms of riders, but in terms of staffing. And we saw some pretty dramatic staffing challenges during COVID. At one point, we were staffed at less than 30%. So we had to make some route adjustments on the fly based on staffing. They were things that we did the best we could to put them together and try to do what made sense. But as we've recovered our staffing, we wanted to be sure that the way we built back was better than what we had before, and also keeping in mind the strategic plan goals of focusing service on those who truly needed it and being mindful of the system efficiency. So with all of that in mind, we hired HDR to do the transit routing study for us, and they are here to present today, and this will conclude their effort on the transit routing study. And from this point forward, staff will be making recommendations to council on changes to the transit system as appropriate during the budgeting process.
Okay.
Thank you, Mr. Mayor, members of the council. Thank you, Sharon, for that introduction. As Sharon mentioned, my name is Joshua Matthews. I work for HDR Engineering. I also have Kevin Noon behind me, one of my colleagues. We're both transit planners based in our Phoenix office. We also have offices in Tucson. And as Sharon mentioned, we're here to talk to you all about the transit route study. So first and foremost, this was a study that was funded through a Federal Transit Administration grant. The city initiated this with a request for proposals in early 2025, and we actually began working about a year ago, around February and March of 2025. The study was really focused on three main steps. First and foremost, as you see on your presentation, existing conditions. We then moved into community engagement, wanting to hear from the public, and then developing final recommendations. And I'll touch on each one of these here in a second. But really the overall purpose of the study, as Sharon mentioned, was to look at the system holistically, to look and see if there's opportunities to improve its efficiency, to enhance the overall rider experience, and to see if there are any opportunities to improve cost effectiveness. We know we have fixed budgets and we really wanted to work within the constraints, as well as have plans for long term if the city has additional funding that opens up, and what can we do to continue to grow a system that has shown a lot of increase in ridership over the last few years. So starting with existing conditions, there was three parts that our team looked at. First and foremost, we wanted to look at the previous work that had been done over the last about 10 years. So what studies, what plans, what policies has the city and its regional partners implemented that could impact transit within Sierra Vista, as well as transit that is in the surrounding areas. So we looked at 11 different local and regional plans, some, like I said, dating back almost 10 years, but some that are more recent, like the short range transit plan that is just about 5 years old and kind of came out right when COVID was hitting. Looking at the general plan, both the 2030 and the 2040. We also looked at regional plans, the regional transportation plan. The goal here is really to synthesize everything that has been done from a framework of not only transit, but also safe and accessible connections to transit. So think sidewalks, streets, the whole transportation system. How does it all work to move people not only within the city, but to the surrounding communities around Sierra Vista? And it gives us, the planning team, the context to understand what the city has worked towards and achieved over the last few years so we can set ourselves on a good baseline as we begin our analysis. So speaking of that analysis, one of the key things that we do is what's called a transit propensity analysis. And very simply, we look at census data And historically, there has been a strong correlation between certain socioeconomic or demographic factors and people's likelihood to utilize transit. And what we want to do here is we want to start to layer those on top of each other and assess a score for each one of those categories. And as we layer those on top, as you can see on this map on your screen, it starts to show the areas of the city that are more likely to support transit. And so I've listed a few of the data inputs here. A lot of it makes sense. If you have a lot more people, if you have a lot more jobs, people are more likely to use a diverse transportation options. We also have certain populations like minorities or low income or people who don't own a car that are more likely to utilize transit or need and be dependent on transit. And then we have our youth and our senior populations who utilize transit maybe out of necessity because they can't drive yet or because they don't want to drive anymore, but they still want to have that mobility. So the map you see here is that buildup of that transit propensity, and those darker areas are the areas of the city that are more likely to support transit. The really fascinating and beneficial thing that this analysis came out of was one of the first things that Sharon and her team talked to us about was transit ridership comes from the West End and it goes into the commercial part of the city. And that's exactly what we saw in this analysis. So it was really good to see those anecdotes be supported by the data and give us an idea of this system and where is that ridership coming from and where is that ridership going. The last part of this existing conditions assessment is what we call an operational analysis. And really this is, as transit planners, the nitty-gritty. So we're looking at how is the system operating today? Where is it going? Where is it taking people to? Where are people coming from? What are those stop locations look like? What's the infrastructure, the bus stops, the transit center, the public works building where maintenance is going on? We want to understand how this system has been built up over the years and how it's operating today. We also wanted to look at activity centers and where are people likely going to want to go not only today and historically, but in the future as we had discussions with staff to get an understanding of the city and its transit system. The second part of this, as I mentioned, was community engagement. One of the things we heard from staff was it is and always is important to get out, and something we support is get out and talk to the riding public as well as the non-riding public. We want to understand the perspectives from both populations. And one of the main ways that we achieved this was through two separate surveys. So we did what's called a public perception survey. And this survey was open to anyone who was willing to take it, any Sierra Vista residents who were willing to take it. And it asked questions about their perception of the transit system. So it asked questions like, are you aware that Sierra Vista has a transit system? And I believe it was 94% of respondents said they were aware. So that's great to hear. They know that that system is there. We asked what their perception of their system was. And one of the things that we told Sharon we love to see was 8 out of 10 people saw their transit system in a positive light. And those are great numbers to hear when we look at nationally how people view their transit systems. So we wanted to get those understandings. And we asked people questions like, what would get you to ride more? What amenities would be provided? What's important to you from a frequency or where you should go, where you want to go? So those type of things. The other survey that we performed was called an onboard survey. So we actually had surveyors come out with iPads, get on the bus, and sit down next to riders and ask them questions. Where are you going to? Where are you coming from? Socioeconomic and demographic questions if they wanted to answer those questions. And that onboard survey really helps us to understand what riders were doing. It gets even deeper than what that census data can tell us. In addition to that, we also did some additional outreach. We provided kind of what you typically would expect, like a project website, newsletters, materials that we gave to Sharon and the transit team to hand out at the transit center, on the buses, to make known that we were doing the study and to solicit some of that input from those surveys. And then we also had staff come out in the fall and participate what we call pop-up events, where we basically go to an existing event that the city is hosting or providing, and we have a table and we provide information about the study. So we attended Oktoberfest and Art in the Park in the fall of 2025 to just really build up that knowledge that this study is going on and to solicit that input. We also provided a presentation to the MPO, their Transportation Advisory Committee, to give them and solicit some of their input on this study. So from a results perspective, one of the things I wanted to highlight here was just a couple maybe anecdotes. So one of them was this quote from a resident. They said, "I haven't had to take the bus, but I'm getting older and one day I may have to. And thank God for the bus system we have here in Sierra Vista." And I love this because it pushes, or it really helps us understand that even people who don't necessarily ride the bus today are relying on that system in the future. And not only do we have the fixed route bus system here in Sierra Vista, we also have paratransit services. And so we're really impacting a lot of people and a lot of their ability to maintain their mobility. So from an interaction perspective, we had 380 in-person interactions. We had an additional 75 social media interactions with the support from the city's social media team and their public outreach team. We had over 17,000 views on our posts during social media. And for our surveys, we had 163 survey responses. One thing that's important to note about these numbers is on average, we have about 570 riders on the system per day. So these numbers are really good relative to how many people are riding and getting a really good statistical snapshot of our riders and the Sierra Vista public. And this word cloud just highlights some of the things that we heard in our responses during those surveys and in our interactions with the public. There's a focus on a desire for more frequency, for reliability, connectivity, bus stops, more routes, more amenities. We saw a desire for a safe, accessible, and mobile system for everyone within the city. And it was something that was really great to hear. One last little anecdote from an outreach perspective. The last time I was here in Sierra Vista, I went on the Blue Route North, and it was amazing. I told Sharon and her team after this, every single person that got on the bus, that operator welcomed them by name. And that is something that, that personal level of service is not something you see very often in a transit system. And it's something that was very welcoming from our perspective as transit planners. So the last part of the study, and I think the meat of what we're here to present to, is the recommendations. And really what we wanted to, as I mentioned at the beginning, we wanted to look at areas that we could optimize, not necessarily stick to the exact system that we have, but to just right size it and fine tune it, to make it more cost effective, to try to maintain the existing funding levels as best as we can, and to provide that framework for the possibility of expanding and maturing the system as it continues to grow. And so some of the primary objectives I have listed here, things that we heard from the public, also discussions we had with staff and your city staff based on what they've heard from the different plans and policies that the city council as well as the regional bodies have put forward. So we wanted to maintain service coverage. As an example, what we heard from staff was it is super important that we continue serving the hospital. Even though the hospital is somewhat a little bit of a trek out east, we need to maintain that coverage. We need to maintain that service. We wanted to limit duplicative service, especially duplicative service that isn't there for a necessary reason, because ridership is super high. We wanted to fine-tune and right-size that. We wanted to optimize service efficiency, and we wanted to look at what it could look like to extend service hours and the days of operation. Now, I know that this is a very difficult table to read from a distance, but I think the important things, and we're going to talk about each one of these on the following slide, so you don't need to capture everything as you're looking at it. But the two main types of recommendations that we're making are route modifications, as well as changes to frequency, or how often the bus arrives at a specific stop. And I want to touch on, because we'll go through the short-term recommendations individually, but I wanted to touch on this slide, the long-term recommendations. And one of the things we heard in our interactions, and it was kind of outside the scope of our study, but was a desire for inter-city bus connections. So that would be service to Tucson was one that we heard, but service outside of Sierra Vista, but connecting the cities within the region. And beneficially to us, ADOT is actually looking into doing an intercity bus study. So from a long-term recommendation, we told staff this would be a great opportunity to engage with ADOT and look at the possibilities of them funding intercity bus service that goes from Sierra Vista to other destinations around the region that residents want to go to. So I just wanted to highlight that one real quick. And then from the long-term recommendation, we looked at what it would cost to and what it would be necessary to implement service on Saturdays and Sundays and expand all the routes to 12 hours per day. Those are kind of the standards of, as you look at systems that have fully matured, is providing that service on the weekends and providing a 12 to 14 hour span of service on weekdays. So we're going to go through each route here. We're going to start with the pink route. The pink route is the most well-ridden route today. So for every about 5 riders that are riding the system, 3 of them are riding the pink route. And so you'll see on your screen, the routing today is on the left, the pink existing. Predominantly, it's picking up riders on the west end. It's bringing them past the transit center for those connections to other routes. And then it's going into that commercial center of the city where the Fry's and the Target, the Food City are, the Hobby Lobby. And so, and some of these recommendations, once we get to the last slide, you'll see all of the routes together and you'll start to understand the system coming together. So some of these take it with a little grain of salt before I get to the very end. So the main change on the pink route that we're looking at right here is on that very east end. And instead of going into the Hobby Lobby parking lot, we're going up and serving the community college directly up in that corner and providing that direct service. There's actually an existing bus stop already up there. This helps us to not only serve a population that typically has high transit ridership of college students, but it also helps to speed up and shorten this trip. And then we'll talk about how we'll cover that coverage here in a second with the gray route. And then right now, today, even though the pink route is the most well-ridden route in Sierra Vista, it's actually the one that has the lowest frequency. So it's at 40-minute frequency. And by making some of these changes, we then are able to hopefully afford to move this up to 30-minute frequency. Ideally, the route that has the most riders, we want to provide the most service to. And that's the right sizing that I talked about at the beginning. So moving on to the blue route, again, with the blue route on the south side, we're sticking relatively the same to its current routing down to the mall and through the community, coming up to the transit center. But the north portion, what we recommended is removing what I call the bypass route. And this was laid out because the bypass route from a speed perspective is maybe a little bit faster, but from a distance perspective, it is much longer. And this, again, is a way to provide cost savings to enhance service and to help pay for that increase in frequency on the pink route, while still serving predominantly the same areas. Now, you'll note the one big difference here is the blue route today serves the Walmart. The Walmart is the second most well-ridden bus stop in Sierra Vista after the transit center. The transit center has all 3 routes going to it, so it makes sense that that has the most riders. But we're going to cover that with some other service. So once you see that whole routing come together, you'll see what we're talking about. And then we'll move to the gray route, and that's the route I mentioned at the beginning, serving the hospital. So we're still maintaining that existing routing going out to the hospital, but on the return trip, again, instead of going on that bypass and going north and coming back around, we're going to stay right past the park and the Walmart, and so this will provide that additional service to the Walmart. That pink route already serves that. So now riders will have 2 options once they're there trying to get back to the transit center or get back to where they're headed. The pink route and the gray route will both show up, and that gives them additional trips and additional ease of getting back to the transit center, which is really kind of the central heart of transit in Sierra Vista. And then we're also picking up that Hobby Lobby deviation that I mentioned that we're removing from the pink route. Now the gray route was, I mentioned the pink route was the most well-ridden. The gray route is the least well-ridden. And so what we're looking at too is today this is 30-minute frequency. So buses are showing up, this is going faster than the pink route. And so what we're recommending, at least in the initial term, is that we move this to 60-minute frequency. Again, to provide that opportunity to increase frequency and right-size the other routes to serve that are currently being served, as well as to provide an additional opportunities for ridership growth on this gray route by serving that Walmart. So altogether, this is the transit system. So the left is our existing and the right is our future. And as you think back to some of those goals and objectives that we talked about at the beginning, we are still serving predominantly all the same areas that we serve today. But we are providing better frequency on the pink route, which is the most well-ridden, and we're reorienting the service so that it's a little bit shorter travel distances and right-sizing it for what we've seen the ridership demand is today. And so that's kind of our full system recommendation, if you will. So one of the important things as part of these recommendations is looking at, obviously, the impacts to cost and the impacts to vehicles. So right now, the Vista Transit system in total, a typical day has 5 vehicles out on the system. In the future, in order to operate the short-term recommendations, you would need one additional vehicle. That is not a vehicle that needs to be purchased today. We have those vehicles. Those are the ones that Sierra Vista already has. And then I mentioned at the beginning the weekend service. So if we were to implement weekend service, that would require 4 vehicles a day. Again, those are vehicles that right now over the weekend are just parked until Monday service begins. So we're not looking at needing to purchase any additional vehicles to make these implementation or to implement these recommendations. One note, though, is obviously if you're putting more miles on vehicles, then it's likely that their lifespans will shorten up and they may require some additional maintenance as compared to today. So from an operating cost perspective, today, in 2026 dollars, the operating cost is a little over $1 million per year. In the short-term recommendations that we laid out, it would be $1.19 million, about an 18% increase. And then to fund those long-term recommendations, that service span expansion, as well as the weekend service, it would be an additional $316,000. As we talk about these dollars, it's important to note where the city currently gets its funding from. And so from an operating perspective, typically the federal formula assistance provides half of that money. Just through the 5307 program that FTA provides. And obviously the city can also pursue additional federal funds or additional funding outside of what you would typically expect from the general fund. And then from a capital cost perspective, that 5307 program supports 80% of the cost. So if you were to have to buy buses sooner, that's how that is split up. So when you think of these numbers, it's just important to note that some of these are local dollars and some of these are federal dollars. With that, I want to thank you for the opportunity to speak to you today, as well as to work with your team. We had a great time working with Sharon and her team at Public Works and the Transit Group, and we hope that you enjoyed working with us as well, Sharon, and happy to answer any questions or hear any comments that you may have, as well as I may direct some of those questions to Sharon.
Excellent. I'll look over this way first.
Look that way. I saw him raised.
Yeah, I feel like you're pointing at me.
Yes, ma'am.
All right. Thank you for your presentation and all the work you put into this. I can't see the guy behind you, but I know that somebody's there, so thank you too. Does the estimated operating costs, is that after the 5307 funding, or is the increase that's recommended?
Thank you, Councilmember, for your question. Mayor, Councilmember, that is the total. So if you were to look at the increase being $180,000, that'd be the total. If you were to get 50% federal funds, then 90% would, or 90,000 would be local funds.
So that's before, okay, thank you. And then Sharon might remember this more because this was back when I was first elected, so I don't remember it as well, but we had the Cochise connector or connection or whatever that would go around. And then we had Greyhound.
Correct.
But I think because ridership was low, they discontinued is that why they discontinued service?
So the Cochise connection is still operating. So if you want to go to Bisbee or Douglas, that is still operating. Greyhound was discontinued during COVID. So there was an opportunity potentially to bring it back after COVID. That has not materialized up to this point. My understanding is even before COVID, ridership, they were operating based on a subsidy. Greyhound had a subsidy. I believe it was for a period of time, 2 or 3 years. And the purpose of that subsidy is to get service established and determine if ridership moving forward would be sufficient to support operations without the subsidy. I don't recall, it's been a while, how long it's been since, or how long transpired, but my understanding is it was not, the ridership at that point in time would not have been sufficient to operate without the subsidy, and Chuck has.
Yeah, Mr. Meyer, or Mr. Mayor, Mayor Pro Tem Flowers, or Vice Mayor Flowers. I gotta get used to that too. Yeah. It's been a long time. The Cochise Connection, I believe, started with a grant from the Legacy Foundation, I think, in order to get that going. So that was subsidized. I'm not sure if the Legacy Foundation is still providing subsidy to that or not, but regional bus systems or bus lines are really, really expensive to operate, and you don't have the density of the population like you do in a local transit system. So they absolutely do require subsidies in order to operate effectively.
Real quickly, when you talked about buses to Tucson, are we talking about our buses or buses from Tucson or new buses? Tell me about that again.
Of course. Thank you for the question, Councilmember. So, Mr. Mayor and Councilmember, intercity bus can take a lot of different forms. It could be fairly small shuttles, so what you could see from coming from the Fort and going into Tucson, just 12-passenger vans, all the way up to big Greyhound kind of shuttle type or coach type buses. The desire really that we heard from the community was to have a public transportation option to go to Tucson. So to be able to, as the city manager was mentioning, to an affordable way to get to other cities within the region, including Tucson was mentioned the most, but other communities were also mentioned.
How do we know if that was a prevailing option that was being brought up, or if it's just a small segment within our citizenry?
That's a great question. So for our survey, as I mentioned, we had a certain number of responses, and some of those responses you can extrapolate up to the population. I would say that these were more anecdotes, but the number of anecdotes were surprising because we didn't really ask more than, I think, one question that mentioned service to other cities. And we had a lot of people come up and provide comments and even say, oh, I don't really need a bus system inside of Sierra Vista, but I need to get to Tucson. How can I get to Tucson affordably without having to drive my own car? That's what we heard, but I wouldn't necessarily say. I think it would probably require some additional research to see. And that's why ADOT, we had mentioned, they're doing a study to look at where they can spend the funding that they get from the federal government that can only be spent on intercity bus. They're looking at a study to see where they could best spend those dollars across the state.
Okay, thank you.
So what is the system called for the handicap or disabled shuttles?
Typically called paratransit, Councilmember.
Paratransit. So that is not part of this study because that's on call, correct?
So, Mr. Mayor, Councilmember, paratransit is on demand. It typically, from federal requirements, because the city receives federal funding, it has to match the service area that is being provided. So, cities can choose to do additional distances. I think it's typically 3/4 of a mile from a fixed route stop. So, you're providing the service that you typically provide to a resident who's able to access it. You're providing it to those residents who also can't access it. But we did look at that, but because our service area isn't changing substantially, we don't see too much of an impact to how paratransit's operated today.
And the paratransit is not part of the cost that you listed on the recommendation slide.
Correct. That's just
an
the operating cost for the fixed route bus system.
Now, do we have? Is it similar to the federal local split on the paratransit?
For the funding, yes. 80% capital, 50% O&M.
And that's all 100% subsidized, correct? There's no cost.
Yes, yeah, we are subsidizing the remainder, yes.
And then a question on your methodology, for example, the gray line. It's currently approximately, so in preparation for this briefing, I started writing the buses around. Just
That's great too.
So I have a better understanding of what all this looked like. And so the gray line is about 30 minutes. So what happens to the bus when it's sitting there, when you drop it back from a 30-minute cycle to a 60-minute cycle? Is it going to be reused on other lines or?
Thank you for the question, Councilmember. So I will hand this one off to Sharon after I mention something real quick. So from within our scope of what we were trying to look at, it was really just the routing and how this is laid out and how the service is going to be laid out. That would be a next step on actually how you're routing those specific buses each day. And there's a lot of different things you can do. You can do what's called fallback operators, which means that one operator rides, let's say, a pink route, and then as they come back to the transit center, instead of staying with that that bus, which is typically what they do today, they could then move to a gray route. So you could have those buses kind of switching around. There's a lot of different approaches in order to implement it, but that would be a next step, I think, as Sharon mentioned on the implementation, would be actually engaging a team whose expertise is on routing buses. And Sharon, I don't know if you have something you want to add to that.
Yeah, Mr. Mayor, Councilman Kilmurray, great observation. It was something that we noted as well is, what happens during that extra time. And our transit administrator at the time, Andrea Castagnon, had some great ideas of things that need to get done around the transit center on a regular basis that sometimes don't get done because people are out on routes and they have only a very limited amount of time between their routes. There's garbage cans that can get emptied. There's areas that can get cleaned. There are things to do. And as was mentioned, we would look at the different possibilities. I guarantee you we would find something for people to do and they wouldn't just be sitting idle during that time.
But the buses would be sitting idle, correct?
That is,
They just turn them off in the little slot.
yeah, or, potentially, as was mentioned, they could be utilized for a paratransit pickup that can't be accommodated with the other buses, but then they would have to be back in time for that bus to go out on its next route.
Now, do we have the expertise available within the city, or when we actually would go, when you take that next step and organize the scheduling and the bus services, is that something that we would go to a consultant again for, or do we have that expertise within the city?
My best guess is it would be a combination of both. We have some very experienced transit personnel. I'll point out specifically Mark Nobles. He's one of our specialists. He is amazing. He's been with our transit system a long time and knows what will work and knows what won't work. Quite frankly. But for some of these things that were mentioned, we might need a little bit of assistance with that if it's something new that we haven't done down here previously, just to get the specifics of how that works.
I got one more question. Yes, sir. Did you look at the both the commercial side and the public side, or were you focused strictly on the publicly available transit? For example, the shuttles that drive around town, the medical cars that drive people to medical appointments, et cetera.
Mr. Mayor, council member, our focus was on public transit. So we didn't look at, as an example, like Uber and Lyft or private providers. I mentioned like the shuttles that maybe go and serve the fort. We didn't look at those as a public transit service because it's outside of the scope of what the city typically funds through the Vista Transit system.
And you also did you look at I guess there used to be a route going to the fort. Did you look at that, find out it's not needed or there was no demand call for it?
Yeah, so I think, and I'll hand this one off to Sharon again here after I mention something. When we looked at our analysis for the fort, it's a little bit challenging for our typical transit propensity analysis because populations that live on military bases are transitory and the census typically captures them as their home somewhere else. So I don't know if you saw on the transit propensity map, it really didn't look like there was a lot of demand from the fort, even though there may be a lot of people coming and going, obviously, from what we've heard, a lot of traffic. So the coordination with the fort was something I think we kind of left to the future of city staff because it would have to be implemented in a little bit different fashion than the Vista Transit system. But Sharon, I don't know if you have anything you want to add about the fort. Go ahead. Oh.
Yeah, Councilmember Kilmurray, we have been in contact with the garrison with regards to providing service on Fort Huachuca, and at this time, they do not wish us to pursue that. So,
yeah.
And I think too, there's changing demographics and the world is changing. I'm not necessarily sure the soldiers really are interested in waiting at a bus stop, and they've been making more use of Lyft and Uber and those kind of things. So they have not asked us to do that. However, they said if they need it, they will get in hold of us, and we've been flexible enough to make it work before, and we can do that again. So,
I have a question.
Yeah, I thought that was the case.
Oh, yes, go ahead, Faye, I'm sorry. Councilman
Okay,
Jackson.
yeah, sir. Question, can you guys provide the age demographic of the response, who completed the survey?
Just so I can make sure I heard your question correctly, council member, were you asking for the age and socioeconomic characteristics of the responses for the survey?
Yes, the age demographic, like what was, like, you know, the most surveys that we received, what was the age demographic that you guys got them back? And how many, as well, another question, what is the approximate total number of surveys that you guys did receive back? Do you have that number by any chance?
Councilwoman, yes, that number was 163. Was the responses we received on both surveys. And to answer your first question, that is all wrapped up in our final report, which we have provided to staff, and I'm sure they'd be happy to transmit that. It's both in an executive summary fashion as well as the full report that has all of the responses and all of the data aggregated for your benefit.
Okay, also one last question, I apologize. Out of the 100 that you received, how many were actually in Sierra Vista area as opposed to being outside of Sierra Vista area? Because I'm sure that probably went to Sierra Vista in the local areas, surrounding areas, is that correct?
Councilman, are you talking about the responses to the survey?
Correct, yes, sir.
I don't have that number off the top of my head. Maybe you don't. I believe most of, if not all of the responses were from Sierra Vista residents. But that's something that would be in the final report, and we're happy to follow up and provide that information to you.
Okay, the age demographic would be really good. That way we can know who's actually requesting the assistance and we can know how to pinpoint it. So that's why I was just wondering, you know, about that. Thank you.
Thank you.
Yes, sir.
Faye, just very anecdotally, based on my experience, I don't think I've ever seen any kids riding alone. The only children I saw were with parents or an adult. And obviously, I always think back to the old days, when I was a kid, and we actually did ride the bus by ourselves without a parent. I think that's, like Chuck said, change of times where kids in that demographic
Right, I think
don't
what
ride
I'm trying to find out, Ken, what I'm trying to find out is, are we getting more college students requesting it, or are we getting our senior citizens community that's requesting it more? Where's the greatest pool coming from? What age demographic are we getting the greatest pool from?
Yes, sir.
That's what I'm trying to find out.
Yeah, Mr. Mayor, Councilwoman Jackson, this is Chuck. I'm just going to ask a question here. Would it be fair to say that the preponderance of our ridership are elderly, disabled, the lower income populations? Would that be a fair statement?
I think that would be a generalized fair statement. Yes, sir.
Okay, thank you.
Okay.
That was my
Okay, that makes sense.
More comments? I have no questions. Thank you for your presentation. Excellent.
Very well done.
Thank you, sir.
Thank you, Mayor. Thank you, Mr. City Council.
And we will go to our next discussion item is travel reports. Sir?
Thank you, Mr. Mayor, members of council. This is a request to take a look at our city travel policy and as it applies to the council. So the request was to take a look at the staff city travel policy and then see how that might work in your council handbook. I believe there are references to travel policy in your handbook already. So we took a look at that, and ours was out of date, particularly with regards to not only administrative changes, but IRS and statutory changes. So basically, what we're looking at are some very basic items changing from P cards to meals per diem. Per diem is much easier to track and administer. Then per diem can be requested before or after the trip when reconciliation of the travel takes place. We've also updated our lodging standards to include Airbnb and VRBO, another thing that's changed over the course of time, so it's not just hotels. And then updated the list of things that we cannot cover. For example, alcohol purchases and those kind of things were things that we didn't cover, and there's a list of things like that in there. Conference expenses to clarify, the allowance for family members going with, but what the city cannot pay for, so the city can pay for you, obviously, cannot pay for the family member. We do provide service with regards to the purchase of plane tickets, and then ask for reimbursement once that's made, because it is, of course, much easier to buy those tickets together as opposed to separately. And then we want to make sure that that's done beforehand, because we cannot reconcile your P-card purchases until that trip is complete. Personal vehicle usage, we changed that from half mileage to full mileage. We're getting a lot more requests, obviously, to use personal vehicles on trips, and it's not really fair to pay half mileage for those particular trips. And also much easier to apply the federal standard for reimbursement against that, easier for staff to deal with. We have a state statute requirement to reconcile the travel in 14 days, so we wanted to make sure we mentioned that. So, of course, the procedure is the same to go ahead and turn that into Yvette or Shella to make sure that that gets reconciled on time. And then also, the use of Ubers, Lyfts, ride shares, another change that's occurred, in society over time. To clarify that it can be used to and from the airport to your place of lodging for the conference, and to and from lodging to a conference covered if alternative lodging is is required. And also, obviously, you could use that if you have other meetings or they're, like going to DC and we have a meeting on the Hill or at the Pentagon, those kind of things. So those are the primary changes. These are updated in our admin policy for staff travel, and then per discussion from council, then we would make those changes to your handbook as well, and then have you vote on it.
So how the diocese, discussion for the diocese, we can move to make.
My understanding is the council follows the same rules as staff, right?
Yes, sir. Most definitely.
Well, we should.
Well, we should. We
can't
can't make us, but we should follow.
No, and that's commendable, because you don't have to, as a body, do that. But, for the sake of transparency and, you do get requests from time to time for travel reports and media requests and those kind of things. So it helps to keep things straight.
Yes, sir. Yes, sir.
Is it the same as the joint travel regulations? Is that what we're, JTR or whatever, is that what we're using?
Yeah, I think so. I haven't.
It looks similar.
Yeah, they're very similar, and a lot of them are common sense, following the federal guidelines
Like
and those kind of things.
IRS guidelines or whatever?
Yeah, we do have to follow IRS and statutory requirements.
Right.
Yeah.
Okay.
The way we know it. Any questions, Councilman Jackson, Councilman Rodriguez?
No, sir.
No, thank you.
Yes, sir.
We will.
One more quick.
Yeah, go ahead.
So in reading this, I didn't see there was any changes to this document that we're looking at, right?
Not really, no. If they are, they'd be minor, but we'll certainly update it and let you know.
So just the topics you just spoke
Yeah.
to are topics that need to be changing.
Yes.
And this isn't an ordinance change, this is just an internal policy.
This is an
correct?
internal policy as it pertains to council and your handbook, and then staff as well.
Okay, thank you.
All right. And so item number C, discussion on call to the public. That was Councilman Rodriguez's item. He would like to move it to the right, and we'll discuss it at another council work session. So we'll go to item number D, reports on recent trips, meeting, and future meetings. You had your meeting yesterday?
Yeah, do you want me to cover that now, or want me to do the
that
next
was
CD?
2 hours.
Well, because it has more to do with when we are presented on the agencies that applied for the community development block grant, but I'll
No,
go
we
ahead
can wait.
Yeah, all right.
Yeah, if you want to.
They narrowed down a list to recommend. Of course, we can still decide to do whatever, but they made some recommendations on how they would like us to see us distribute the funds that we get from CDBG.
Oh, this is neighborhoods yesterday?
Yeah.
Any others?
No.
All right.
And Mr. Mayor,
Sir.
I wanted to go over your work session schedule coming up. Your next one on the 24th is the mid-year budget review, which is kind of also our kickoff for the upcoming fiscal year budget. And of course, there'll be a number of budget work sessions coming up to discuss various aspects of the budget. At that meeting, too, we should have a good idea of what our projected year-end fund balance is, and then recommendations per your policy for the use of those funds in the coming year. So that'll be discussed as well. April 7th, you have your 6-month strategic plan update, and then continuing discussion on the Paradigm contract, and then April 21st, presentation from Mr. Valle regarding Buffalo Soldier City designation, which was requested by Mayor McCaw. So that's what we have right now, and obviously budget will keep us pretty busy here over the next few months.
Excellent. Other questions, discussion? We are adjourned.